Welcome to another segment of ACRP TV. My name is Mike Volkazi. I'm the editor-in-chief. Today, our spotlight is on promoting the patient experience with a dear old friend and a great guy, Shareef Mahdavi, who's the president of SM2 Strategic. He's also the author of a new book called Beyond Bedside Manner, Insights on Perfecting the Patient Experience. Shareef, thanks for joining us. It's great to talk to you again.
Great to be here, Mike.
Let's jump right in. You and I have talked in the past, in the clinical trial industry, the PI issue, physicians getting involved. There's a phenomenon called one and done. I don't remember the number off the top of my head, but a huge percentage of physicians become involved in clinical trials. They'll become a PI. They do it once. They don't like it. They have a difficult experience. For whatever reason, they drop out. The rate's very high. So I'd like to sort of use that kind of as an umbrella to talk about your book. And there's some really great ideas here about how physicians and others in the practice can connect with patients and work on the bedside manner and the patient experience. But let me ask you first, in the book, I thought it was really interesting, talk about what patients today are, and customers, what are they expecting in their interaction with healthcare providers?
Mike, it's a great question. And the problem that doctors face is that the world changed completely in terms of what customers expect. And there's a couple key reasons for that. First, the financial burden has shifted greatly from a third party to the consumer. Think about it: increased copays, deductibles, premiums, somewhat less coverage. So the consumer is going to be more discerning about what happens with the money they're spending. Right in parallel with that, you've seen the absolute rocket rise of elective procedures. These are technologies that create benefits that are so good that doctors charge full price for them and patients pay without any insurance coverage. Think about LASIK, the industry that I helped get started. Think about everything going on in aesthetics today and what Allergan has done with Botox. It's amazing. I mean, people will pay, particularly this aging baby boomer population that wants to stay, look, and feel young like us. Absolutely. So that's a big market. And when you put those things together, and along with the just rise of customer service across pretty much every other industry, healthcare is now in the spotlight, and doctors are in the spotlight, and customers, patients expect more, period.
Now, taking it to clinical trials again, as you know, most people learn about a trial either from their doctor, practitioner, or a family member, or a friend who's been through one and had a good experience or something positive. So to that point in your book, I want to talk a little bit about the way you even talk about eye contact and how you dress. But what are some good ways to connect with your patients to leave that good lasting impression?
Well, I think in the context of the clinical trial, one thing is really, really important. And, it's really easy for a doctor and for a practice to adopt the mindset, for the patient, this is free care. So, and they use that, comma, and then whatever follows that. We don't have to treat them as well. We don't have to be as nice to them. And I'd say actually it's the opposite. Regardless of what that patient is coming in for, whether it's a standard reimbursed appointment, whether it's a clinical trial, or whether it's a self-pay procedure, to me, I think every patient deserves a better experience. And look, every doctor, every person who's part of a practice team, they're all customers too. They know this from their experience as consumers, what they expect when they walk into a store, when they go online to buy something with the website, how easy it is to do website, when they're spending their own hard-earned money, they expect to be treated well. It's no different in a doctor's practice, absolutely no different. So when it comes to clinical trials, I would just say that, it's the same as every other part of medicine. It doesn't get a pass because it's quote unquote free to the patient. I think that's a poor excuse for it's a pure excuse for not giving great service and great experience.
I want to talk to you about, I touched on it a second ago, but about what patients remember, because obviously that's so important in the experience, because I'm sort of connecting a dot here, I think, but if a patient has a good experience with a physician, whether it's a clinical trial or any interaction, they're much more likely, I would think, to tell someone else, hey, about this trial, you want to look into this doctor, check out what they're doing. How do you as a physician or in a patient, a doctor's practice, how would you be cognizant of what patients are going to remember? I mean, first off, what will patients remember? And how do you, address that in a positive way?
Sure. Let me take this in two pieces. First, let's just kind of talk about what patients care about, which, you think they care about the clinical outcome. They do, but that's not all they care about. That's at the core. Beyond that, they care about a whole lot of other things. Was the person giving me eye contact, whether it's the receptionist or the doctor? Was I respected? Was I treated well? Was I called by name? Is the office clean or is it dirty? These are all the signals and cues that have nothing to do with clinical care, but have everything to do with the perceptions that are being formed in the patient's mind, literally second by second, minute by minute. You can think of it almost like a stock ticker where the doctor is being evaluated up and down, up and down. And so you want to do things in the environment that help eliminate negative cues in the experience, right? So you think about that old sliding glass window, doctor's office, that is from another era. Even the notion of a waiting room, just calling it a waiting room in 2020, nobody wants to wait for anything, regardless of their age. Right. So I think it's paying attention to these things, and I can summarize it in a simple statement. If you think of the services you provide as what you do, it's what you do. Think of the experience as how you do what you do, okay? And if you focus on how you do what you do and you bring intention to that, it's easy to train a staff to say, you know what? We're always going to smile when we first see a patient. Wherever they are in the practice, we're just going to smile and say hello. We're going to make that a standard in our practice. I guarantee it's not the standard in most medical practices. They don't, because people get under stress, they get harried, they're grumpy, they had a bad date the night before, whatever, okay? But when you're in the practice and the doors are open and patients come in, you are on stage. Much like a concert performance at a theater, Broadway, whatever. When the curtains open, they're on stage. There's no chit chat on stage about what was going on the weekend, right? You're on stage. It's the same thing in the practice. You're on stage and you need to act as if you're on stage, because that's what patients expect.
Now, the book is called Beyond Bedside Manner, and you've gotten a lot of great testimonials. And I wonder if you've heard from people who are clinical trial practitioners and PIs. I think you have had some readers. What kind of feedback have you gotten? I know the book's just out, but...
Well, I'll tell you, the doctor that's on the cover of the book, Vance Thompson, has his practice, Vance Thompson Vision, has now done over 200 clinical trials. So they are committed to research. They are the other end of the spectrum from the one and done. They love having cutting edge technology. They love great research, but guess what? They also love delivering an incredible patient experience. They do that day in, day out. It's part of their brand. And it's an example of what can be achieved in a medical practice. So it's absolutely achievable. There's no reason for a doctor to say, but I'm a doctor, that doesn't count for me. I'm not, it's not fair that patients review me online, just like they review automobiles, restaurants, and hotels. I say, you know what? That ship has sailed.
Fair or not, it's happening.
And leverage online reviews to your advantage. Use that feedback to help you improve. So anyway, that's, you had asked about PIs, clinical trial investigators. A number of the doctors that I work with who were pre-readers of the book are involved in clinical trials and have that as part and parcel for what they do. The concern that you shared over the one and done phenomenon has to do with expectations. And if you think about it, the practice had one set of expectations about what it was going to be like. Okay. The reality of what it was like was very different.
Right.
Their motivation for doing the trial was probably about doing good for their profession, advancing the science, but also monetarily. And I don't blame them, because sure, it's harder and harder to scratch out a living in a private practice. But what happens in reality is that the work, either the workload or, I would say the workload got to be too much relative to the compensation, or just didn't fit. Doing research did not fit into a busy clinical practice. And so that's where you get the one and done. Mike, this notion of expectation and meeting expectation or understanding expectation is a theme throughout the whole book. We need to when it comes to telling patients what the outcomes might be, for example, we need to under-promise and over-deliver, as opposed to the opposite, where we say, wow, it's going to be incredible, very few risks. The outcome isn't as good as they like, and now the patient's not happy. Or it's a great outcome, but the rest of the stuff wasn't so good. So you can have patients that are, in LASIK, we'd call it 20 unhappy. Instead of 20, they might be 20/20, but they're not 20/20 happy, they're 20 unhappy.
Right.
So you want to pay attention to everything that's outside the clinical care to basically increase the odds in your favor that the patient's going to be happier. We know traditionally that doctors who are nice to patients don't get sued, okay? Now, some really good clinicians take offense at that. I say, no, that's just the reality of human nature. But guess what? Be nice, be kind, do things to make it better in your practice, and your patients will respond.
This has been another ACRP TV segment, our spotlight on promoting the patient experience with our dear old friend, Shareef Mahdavi, president of SM2 Strategic, and we've been talking about his new book, Beyond Bedside Manner, Insights on Perfecting the Patient Experience. Shareef, great to see you again. Thanks so much for your time.
Mike, thank you. Have a great day.